Welcome to the Kenya Women and Children's Wellness Center. This impressive 446,700 square foot building was designed by the renowned Perkins & Wills from the US. Construction on the site began in 2018. Phase 1 of the development is almost complete and will be ready for use in early 2023.
I'm Dr. Elizabeth Messick and the Global CEO of the Kenya Women and Children Wellness Center. The center is a generous donation of the James Raymond Jordan Foundation International and their partners. Their mission is to build capacity in developing communities worldwide. They collaborate with local communities to implement sustainable solutions to health and education to reduce disparities. They have undertaken a huge investment in constructing the building. However, the plan is to hand it over to Kenyans and the region. It is built for Kenyans to be run by Kenyans. This means we must reach out to strategic partners for support and put sustainable plan in place as soon as possible.
KWCWC is a state-of-the-art multi-purpose center and is a 3-phase project. Phase 1 is complete and includes an array of facilities: a gender violence recovery center, a 24-bed safe house, a 180-seater contemporary-style conference auditorium, a 3-story learning institute, and a research and data center. Phase 2 and Phase 3 are upcoming developments, which include a 184-bed multi-specialty tertiary-level hospital, a forensic laboratory, and a blood bank.
We would like to employ a diverse funding strategy. This would involve bringing on various government agencies, academic institutions, philanthropists, and/or even the private sector to help us establish our mandate. We're at 95% completion, hoping to operationalize the facility come January 2023.
The Kenya Demographic Health Survey indicates that over 56% of women in the 15 to 49 age group have experienced some form of violence. Gender-based violence continues to plague the social, economic, and emotional well-being of the victims, majority of whom are women and children. The Kenya Women and Children's Wellness Center presents a one-stop shop GBV center, increasing access to prevention and response support services to survivors.
My role as a program manager is to design, oversee, and coordinate different programs, monitor and evaluate their performances, and align them to KWCWC strategies. In the last 12 years, we have implemented various community outreach programs, one of them being gender-based violence prevention and response. Under the gender-based violence prevention, we've sensitized the community on the various forms of gender-based violence, the causes, and the consequences. Under the response, we build capacities of healthcare providers and law enforcers in handling cases of gender-based violence.
My name is George Mose. I am the area chief of Roysambu location. There are very basic issues that are affecting women and children within our community. We have gender-based violence. So the institution, through Madam Jane and Madam Pauline, could come out and we gang up together to ensure that the community is sensitized on the need to avoid gender-based violence and to embrace alternative dispute resolution mechanisms.
The Kenya Women and Children's Wellness Center will continue to engage with communities across the country to create awareness against GBV. The community serves as an important place to screen, identify, and refer survivors to care.
Community health volunteer is linking the community to the facility. I am linked to Mathare North Health Center. GBV group came to teach the CHVs in Mathare North, a training that went for a week, and that is when I identified myself that I was also suffering. And so I decided to seek help because of course you can't give what you don't have. But right now as I speak, I'm fully healed.
The main goal of the Wellness Center is to empower women from disenfranchised communities. When we talk about empowerment, we talk about empowering health. When a woman has access to basic health services and is healthy, then she is able to work and contribute to her community.
I envision the center to be a high-tech regional hub, a household name in the region, and a source for the most up-to-date data. A digitized health facility providing telehealth in the country and the region, and revolutionize health service delivery.
The center will provide the following for survivors: quality clinical care services, legal aid services improving justice outcomes, psychosocial support services, and economic empowerment programs. A one-stop shop to address three interrelated systems: health, social, and criminal justice.
What we need right now: strategic partnerships, funding, and community engagement. Did I say funding? Yes. Funding to support the center so it can get up, walk, and then run. This is for Kenyans to be run by Kenyans.
The Kenya Women and Children's Wellness Center. Partnerships powering people.